Hi Bashira, I'm Dr. B. I'm going to be performing a thorough hand exam on you today. Thank you for laying them out for me. Are you currently in any pain or discomfort?
No pain, no discomfort right now.
Okay, so taking a look here, any history of arthritis or joint pain, anything like that?
No joint pain. I went through a period where I was having some like numbness and tingling in the hands.
Okay. So we definitely want to do quite a bit of sensation testing then to see if that's a neurological issue or a circulation issue, anything like that, a nerve issue. So anything else of note, any particular issues with the skin, dryness, strength, anything like that?
No, I try to moisturize my hands every day just after washing them.
Okay. All right, so let's take a look. And again, this is a thorough exam, so I may just take my time. But if anything's uncomfortable, let me know. I will start with your right hand, so you can relax the left. Perfect. So with my light, initial exam, I'm looking for any bumps, bruises, scrapes, things like that. I do see the nails have maybe a little clear polish on them. Mm-hmm. Okay, yeah, it did seem a little shinier than normal. Just the cap reflow. And then it's just a little bit slower than normal. But do you have any coolness in the hands? It feels pretty warm.
Yeah, I was someplace cold earlier in the day, so maybe they're still trying to get there. Yeah. I feel pretty warm in here.
Okay. Can you flip the hand for me, please? Thank you. The side of the hand looks really good. Looks well moisturized. I can definitely tell that you're doing that, which is great. Okay. Just going to be feeling the hands now for any pain. No swelling in the joints that I'm noticing. Is it causing any of that tingling when I'm pressing on you here?
No. I did some hand exercises, and I think it was just my job. I was doing a lot of like typing and wrist work, and so it subsided quite a bit.
Was it the carpal tunnel here?
Yeah, that's what they were thinking it might be.
Okay, relax this hand. I'll take a look at the other one. You can put that one back. Thank you. Same thing. Just looking for anything obvious. Hands seem relatively symmetrical. Cap refill is faster on this hand as well. Looking at the nail beds. And flip the hand for me, please. I do see just a tattoo there, right?
Yeah.
And how long have you had that?
I've had that one since I was 18, so
at least several years.
Yeah, several years.
And no issues with rashes or discomfort there?
No.
Good.
I actually have one on my other hand also.
Didn't notice it. Oh, right on the inside there. Okay, yeah, that looks fine though. It looks very healed. Bit hidden there.
Yeah. Little secret tattoo.
I love that. Okay, there's just one little freckle there. Nothing really major to be concerned about. Again, I'm going to be palpating here. Just let me know if there's any pain or tenderness. Okay, place both hands down for me, please. I'm going to just apply some gloves for the rest of the exam. I will be just touching your hands quite a bit, and I don't want to transfer any oils over to you. I'll look with a magnifying glass. So just a little light, and I'm looking very close up at the structure of the skin. It looks very healthy and shiny. Good even texture, consistency, and color. very consistently healthy all around. So that's great. I'm just going to look at that tattoo as well a little closer. But it does look fully healed, and it actually looks like it's perhaps fading just a little bit as well. Over time, we may need to get that redone, so if you get it redone, you just know how to take care of it, obviously. So there are just a couple of little spots here and there that just look like from age or a little small scarring. I can see here you have a freckle of some sort as well, a little bit of a raised mole. Just going to measure that. But it's very small, symmetrical, yeah, millimeter, nothing to be worried about. That hasn't changed at all, right? Okay. Now it just looks like a little scar or something here as well.
Yeah.
Not bothering you at all, though? Okay. I think that that's fine. Flip the hand over. Again, I'm just going to be taking my time here, so thank you for your patience. Don't want to miss anything. The fingerprints seem to be healthy, no burns or scrapes. Just going to be palpating the palm. I know how to just move this hand over and set that one aside for now. Do the same thing. Again, nothing remarkable on this side, and the skin looks really clear at the wrist. Again, just a little bit of a freckle there, a little bit more asymmetrical, but still pretty round, not raised. And the tattoo looks great as well. One little freckle right on the pinky finger. Has that been there a long time?
It has, yeah.
A lot of times with the freckles on our hands and feet, we have them pretty much since birth. Okay, again, just press here. Feeling especially for that big muscle right here on the thumb. So you said you type a lot, right? So that can get very tight, and I can feel yours is very tight. Okay. Place both hands up here for me. I'm going to want to look at the strength in your hands and the range of motion. So some of these I'll have you do on your own. So you take this hand and just down like this and up like that. And can you move it side to side? Good. I'm going to have you do the same thing just against my resistance. So put your palm up and push down on me and pull back. Good. Can you put your thumb up like this? Just like that. Don't let me pull it down. Good. Nice and strong. Don't let me push it up. Push me down. There you go. Spread your fingers out nice and wide. I'm just going to take a piece of this, put a piece of paper in there. Can you pull that away from me? Good. Nice and strong. Okay. I'm going to hold down your fingers, and I want you to just lift your thumb. Good. Just lift the pointer, middle, there, and there. Okay. Length of the joint, let me move it around here. You make this sign for me. Don't let me pull it out. Okay, very good. And just touch each finger just like that. Can you go a little faster? Very good. And relax. We're going to do the same thing on this side. So up like that and down like that. Any pain with that?
No.
Okay, up again. Pull. Push. Very good. Side to side for me, please. I'm just going to hold that there. Push me away. Push me away. Okay, thumb up. Very good. Hand down for me, please. with that. Good, a little more range of motion on this side actually. Is that your dominant hand?
It's not actually.
Okay, interesting. Good. And just like that. As fast as you can. Okay. Relax both hands here for me. So range of motion looks good, strength looks good. I want you to hold up. I want to test that carpal tunnel. So that is probably a test you've had done before, right?
Okay.
I'm just going to tap here. Any tingling coming down?
No.
Okay, good.
Pretty
Yeah.
good.
That's okay? All right. Relax the hands. I'm just going to measure them side to side. This tool is really just to look for symmetry. So I'm not really looking for a specific number, but just that it's pretty much the same. And there's no obvious major issues or changes side to side. Just getting from the wrist to each finger here. It's the same. Just retest that one finger there. Definitely a little bit longer on that pointer finger on the left side. Nothing medically dangerous about it, just something to note. Okay. Just hold your hands up for me like this. And just looking for the symmetry. Okay. So size of the hand is not that important. It's more just to see if there's any wasting or shrinking side to side. Indicate a problem with the left or the right brain. Anything that would be causing us to have less muscle strength one way or the other. But that looks perfectly symmetrical and fine. Right, while you have these out, I want to do a bit of sensation testing because you were having that tingling. So I'm going to start out with just a little cotton stick here. You'll feel me touch you, just like that. Do you feel that up here?
Yes.
Okay, so close your eyes. Just say yes when you feel it.
Yes. 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 Yes.
Okay. Tell me which finger I'm touching you on.
Thumb. Pinky. Pointer.
Okay, am I touching you on the right side or the left side or both sides?
Both. Left. Right. Left. Left. Right. Both.
Okay, say yes when you feel it on this side.
Yes. 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 Yes.
And tell me what finger I'm touching you on.
Thumb. Pointer. Pinky.
So it seems like your generalized sensation is intact, but I want to just test a couple more things. I've got a very sharp tool here, and I want to run it down the hand. And I want you to tell me if it changes, feels dull, more dull at any point. So if it feels the same sharpness all the way down, you can just say same. If it starts to feel more dull, I want you to say dull, okay? So keep those eyes closed. Does that feel the same all the way down?
Yes, same. Same.
That change at all there?
It did feel a little lighter towards the end.
Okay. How about that?
Same. Same. Same.
Do the same thing on this side.
Same. That felt lighter towards
Felt
the
lighter? Good.
Same. 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 Same.
Very good. What temperature does that feel like to you?
Cold. 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 Cold.
Okay. I'm going to be hitting this. It's going to make a little buzz. I'm going to place it right on a joint. Do you feel that buzzing?
I do.
Tell me when it goes away.
Stopped.
Good. Same thing on this side, right over on here, on the pinky. Tell me when it goes away.
Stopped.
Mm-hmm. You feel that?
I do. Stopped. Stopped.
Okay. So your vibratory sensation is also intact, which is good because that means not only you're feeling right on the surface, but feeling a little bit deeper inside, past there's the initial top layer of the dermis. Got just a couple more sensation tests here, just a little puff of air. I want you to tell me if that elicits any of that tingling. So if you feel any tingling, let me know. Otherwise, I'll just keep puffing around. Any tingling there?
No.
Try this side. Nothing?
No.
Good. So moving on. I think the sensor is fully intact. I don't think we need to do any additional testing this time. You just flip your hands for me. We'll just do a couple of quick ones here just to confirm. But usually you can feel, if you can feel it on the outside, you can feel it on the inside. But I'll just say yes when you feel it.
Yes. 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 Yes.
Good.
Yes. 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 Yes.
And does this feel sharp all the way?
Yes.
Same here.
Yes. Same. Same. Same.
On this side.
Same. 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 Same.
Okay, I think that's fine. I'm going to flip your hand over here, do a couple more neurological tests that are a little different. I'm going to be moving your finger down or up, and I want you to tell me what you feel.
Down. Down. Up.
Okay, how about on this side?
Up. Up. Down.
Very good. Over here?
Up. Down. Down.
Good.
Down.
Tried to trick you there.
Up. Down. Up. Up.
All right. I'm going to give you something to hold. So again, close your eyes. I want you to tell me with this hand only what this object is.
Pencil?
Okay. And just on this paper here, I want you to show me how you write. Just write "today is a nice day." Or today. Just write the word "today." Okay, so the function in the hand is good. Strong there. Okay. Closing your eyes again, I'm going to hand you something else. And I want you to tell me what it feels like. So open this hand for me. What does that feel like to you?
Tissue.
Okay, very good. And show me how you blow your nose. Perfect. So you have good hand-eye coordination, and here I can put that in the trash for you. So basically your hands are able to, your brain's able to tell your hands what to do. They do that. They know where they are in space and time, which is very good. It's exactly what we want to see. I'm going to test some of the reflexes in the arms and the hand. Starting with this one, so just completely relax for me. Okay, not super brisk. Good. The reflexes are quite not very brisk. Is that normal for you to not have very reactive reflexes?
Yeah, I think it is.
Okay.
Doctors usually have to bang a couple.
There, I got a little one there. Yeah, so the reactivity there, it's not worrisome, but it's something we like to track, especially if it's paired with any other symptoms. So if you were having, you know, trouble with getting a reaction from the reflexes in addition to tingling or numbness or any other neurological symptoms, we might say, that's not quite normal. But because you have no other symptoms, not everybody has super reactive reflexes, and that's okay. So we've done most of the basic functions of the hands. So I now want to just use the hands when it comes to flexibility. I want to see what your different ranges of motions are. So I want you to open as wide as you can. Okay, and now can you lift this one off the table here, and don't let me close them. Very strong, very good. And relax that one, and this one, lift it off the table, and don't let me close them. Good. A little bit more strength in the right hand, but you say you're right-handed, correct? Right. So that makes sense. You more strength in the hand that you use more dominantly. Can you show me how you would brush your teeth? That hand? Very good. And what about how would you open a lock, like a combination lock? Very good. Okay. Can you point to, I just want you to point, so just point behind me. And can you do it with the other hand? Okay, any pain or issues with that? Okay, feel for some of the lymph nodes in the arms. Just going to try the reflexes a slightly different way. Yeah, see there's a little bit more reaction right there, just by pressing on that tendon. I'm now going to test the, so the capillary refill was a little bit slow rather. So I'm going to test it a different way. So I'm going to have you flip your hand over. I'm going to hold right here. I want you to close your palm really tight and just pump it. So open it up now and close it, open and close it. And let it open. And that color comes back very quickly there. Same thing on this side. So holding here, open, close. And open. Okay, same thing there. You see the pink starting to fill in. So yeah, so the blood flow is really good. I'm glad that that nerve pain doesn't seem to be bothering you anymore. Flip over one more time. I just want to triple check since any pain with that. That's all better now. Yeah. Good. And so what, you just had some exercises, the physical therapy for that?
Yeah, some physical therapy.
Okay, and that seemed to work for you.
Yeah.
So I suggest definitely continuing to do that because it can easily come back if that nerve gets pinched again. I'm sure they explained to you how the carpal tunnel works, but essentially you're just putting a lot of pressure on it with constantly like this. If you have a pad you can rest your arms on, but stretching and strengthening is going to be number one. Okay. So Bashira, I think that's the end of today's exam. Do you have any remaining discomfort or questions for me?
No, thank you so much.
You're very welcome. So I just suggest coming back in a year for another check because you do have that history of tingling and carpal tunnel. But otherwise, if you're feeling great, then that's great news.
Thank you.
Thank you.